Someone hacked into the hospital system and used my identity to get treatment. How could their computer security be so bad?
My neighbor, the nosy nurse, told everyone about my surgery. I really feel like my privacy was violated.
I specifically asked not to be listed in the hospital's directory. And then my ex-wife shows up. How did she know I was here?
As caregivers, we strive to provide the high-quality care our patients deserve, and we also strive to prevent situations like we just saw from ever happening. In order to do that, we need to protect the confidentiality of our patients' personal information. Although this has always been a priority, it's now a federal law. The Health Insurance Portability and Accountability Act of 1996, also known as HIPAA, is an extensive law with several pieces, but two of the biggest pieces are the privacy and security rules. The privacy rule covers required policies and procedures for ensuring confidentiality of protected health information, also known as PHI, and giving patients access to and control over their information. The security rule instructs organizations on appropriate physical and technical safeguards to protect that information. All PHI in a patient's record is considered private, but prior to HIPAA, there was no federal law placing restrictions on how an individual's medical record is shared, and state laws were inconsistent. HIPAA does not restrict healthcare workers from sharing PHI for the following reasons. Treatment. Doctors, nurses, and other caregivers are free to share information as necessary to properly care for a patient. Payment. Healthcare organizations are permitted to share PHI with insurance companies, Medicare, and other private and government payers. Healthcare operations. Facilities are free to use patient information for activities such as quality improvement efforts and training. However, if you reveal any patient information to someone who does not need it for treatment, payment, or healthcare operations, you are violating HIPAA and breaking a federal law. Violations can lead to civil monetary penalties for your organization, and in extreme cases where individuals steal or sell patient information, even jail time. HIPAA also requires organizations to establish their own sanctions against workforce members who fail to abide by their HIPAA-related policies. These sanctions can include suspension and dismissal. This video will focus on the key parts of HIPAA's privacy and security rules that you need to know to protect patient confidentiality. They include minimum necessary standard, notice of privacy practices, facility directory, patient access to medical records, password management, viruses and malicious software, physical security. Minimum necessary standard.
Have you heard anything about Kelly? She's been out sick for 2 weeks now, and no one's heard from her. I wonder what's wrong.
Yeah, I don't know. But I know how we might be able to find out.
Yeah?
Let's check her record quickly. If she's really sick, she's probably come to the clinic. Maybe we could send her some flowers or send some food for her family.
Yeah.
Is this access permitted under HIPAA? No. There are many people who need access to this patient's information, including the doctors, nurses, and other clinicians who are directly caring for this patient. But in this case, the clinicians who planned to look up this information were not involved in the patient's care. Therefore, they had no right to look up their coworker's record, no matter how well-intentioned they were. The privacy rule includes a minimum necessary standard, which requires providers to determine who needs to see what information and only provide the necessary information. Some staff do not need to have any access at all to the medical record, and others may only need partial access. The minimum necessary standard does not apply to those dealing with the medical record for treatment. Many organizations have systems in place to track who gains access to records. Looking at a record inappropriately is grounds for disciplinary action and sometimes termination. If patients feel their personal information has been disclosed unnecessarily, they have a right to complain to your organization and even to the Department of Health and Human Services. Let's take another look at this scenario and see one way it could be handled correctly.
Have you heard anything about Kelly? She's been out sick for 2 weeks now. No one's heard from her. I wonder what's wrong.
Yeah, I don't know. But I know how we might be able to find out. We could check her record quickly. If she's really sick, she's probably come to the clinic. Maybe we could send her some flowers or send some food over to her family.
I think that's a violation of her privacy. She might not want us to see her medical information. I know. I'll check with Phyllis. She'll know how she's doing. I think they're really good friends. I'll ask her.
Yeah, you're right.
Let's look at another situation involving unnecessary disclosures.
So did you see Betty Murphy today?
Yes, she had an appointment with me this morning.
Oh, great. I haven't seen her in about a month myself. How's she doing?
She's responding well to the chemotherapy.
Oh, good. I mean, considering her family history of cancer and all those other ailments, I'm surprised she's doing that well.
Have these physicians done everything they could to protect patient privacy? No. Although these two physicians may be legitimately discussing a mutual patient, they have failed to acknowledge that others may be able to hear their conversation. When discussing patients, think to yourself, who else can hear? Try to lower your voice or move to a more private area when you can. Let's see how this situation could have been handled to better protect patient privacy.
So did you see Betty Murphy today?
It's pretty crowded in here. I don't want anyone to overhear us. Let's talk later in my office.
Okay.
Notice of privacy practices. It's important for patients to know their rights. That's why HIPAA's privacy rule requires healthcare organizations to provide patients with a notice explaining their rights and how the provider may use their PHI. Anyone may receive a copy of this notice, even people who are not currently patients. The Notice of Privacy Practices explains how your organization will protect PHI from inappropriate use or disclosure. It also explains patients' rights to inspect their medical records and request amendments to that record, view a list of disclosures of their medical record, and request confidential communications with their providers. The privacy rule requires that providers make good faith efforts in obtaining written acknowledgement that patients received the notice. The notice also must be posted prominently in the organization and on the organization's website if it has one. When patients ask questions about HIPAA or privacy protections, refer them to the notice. Facility directory.
Excuse me, can you tell me which room Mary Smith is in, please?
I'm sorry, Ms. Smith asked not to be listed in the facility directory. I can't give you this information.
Did this staff member respond correctly? No. If patients request not to be listed in the directory, staff should not even acknowledge that they are at the facility. If patients don't opt out of the directory, certain information about them, such as location and general health condition, will be included in the patient directory and available to people who call or visit the hospital. If patients choose not to be included, no one in the organization can give out information about them, including the fact that they are in the healthcare organization in the first place. It's important to remember that this applies to all staff, not just to those at the registration desk. Let's take a look at how the employee should have responded.
I'm sorry, I don't have a listing for Mary Smith. Either she's not a patient here, or she's asked that her information not be given out.
But I know she's here. She's my sister, and I need to see her.
I'm sorry. I understand your frustration, but I can't give you any more information. There's no listing in the directory.
Patient access to medical records.
Please sit down.
Great, thank you.
How can I help you?
Hi, I'm here to pick up my records. I called last week. My name is Jane O'Brien.
Okay, Mrs. O'Brien, I just need to see a picture ID and I'll get them for you.
Great, no problem. There you go.
Thank you.
Did this staff member respond correctly? Yes, the employee acted correctly. Patients have the right to inspect and obtain copies of their medical records, and it's the organization's responsibility to request identification of those picking up medical records. Organizations must respond to written requests for access to records within 30 days if the records are stored on-site, and within 60 days if the records are stored off-site. There are a few exceptions to a patient's right to access. A patient is not allowed to inspect or copy psychotherapy notes or information compiled for use in a civil, criminal, or administrative proceeding. You can't effectively protect patient privacy without proper security measures. HIPAA's security rule requires that healthcare organizations protect against all reasonably anticipated threats or hazards to the security or integrity of electronic patient information, as well as reasonably anticipated uses or disclosures that are not permitted or required. Password management.
Man, they still haven't fixed my account so I have access to the billing system.
That's no problem. I'm about to leave for the day. Just use my password. It's Fluffy12.
Thanks.
Is this an acceptable practice? No. Good password management is a key component of an effective security system. Employees should never share passwords under any circumstance. The most common way that a password is compromised is not by hacking, but by the owner giving it out to someone. No one but you should know your password. If a coworker requests your password, refer them to your organization's IT help desk or tech support office so that they can get their own appropriate access. If you share your password, even if you think it is for a good reason, you are violating your organization's security policy. Another mistake in this last scene was the password that the employee was using, Fluffy12. Don't select a password that will be easy for someone else to guess. Examples of these are pets' names, personal names or fictional characters, any real words, dates of birth. Instead, choose a password that is made up of letters and numbers, is at least 6 characters long, and incorporates both upper and lower cases if your system will support it. One good way to create a password is to pick a subject that interests you, such as sports or movies. Think of a related title or phrase. Use the first letter of each word in the title or phrase to start forming your password, then incorporate some numbers. This will give you a password that appears meaningless to everyone but you. Here's an example of how to choose a more secure password.
Let's see. My favorite sports team is the Boston Red Sox, and they won the World Series in 2004. So the Sox won the World Series would be SWWS. Then if I put the year in the middle, it would be SW04WS.
Along with password management, the HIPAA security rule also outlines what you should do to prevent malicious software from compromising your computer and in turn putting patient information at risk. Viruses and malicious software.
Hey Brian, do you use Instant Messenger?
Nope, never have.
Well, if you download it from this website, we can send each other messages.
Great. I'll do it right now.
Okay, just go to www.
Is this acceptable? No. Software or hardware that is installed without the approval of your technical support department can cause security problems. This includes instant messenger software, music sharing software, remote access software, screensavers, and games. If you install these programs without approval from your organization's technical staff, the programs may disable your computer, threaten your organization's network, or contain malicious software that would allow someone access to your computer. Don't install any software or hardware on your computer without permission from your IT department. Any device attached to your organization's network or your computer needs to be installed with the appropriate security precautions in mind. For that reason, you should only connect other devices, such as laptop computers or PDAs, to the network with permission from your technical support staff. Physical security.
Okay, Ted, I'm going to send you Mr. Ortiz's lab results right now. You should see them in a second, okay? Thanks. Bye-bye.
Double latte and a bagel?
What did the physician do wrong? First of all, the physician should have been aware of his surroundings and whether anyone could see over his shoulder. Physical security measures are as important as technical measures, such as passwords, firewalls, and encryption. Physical security involves common sense steps, such as making sure doors and desks are locked, storing computer equipment safely, and making sure those around you cannot easily view patients' confidential information. In this case, the physician should have been aware of the wandering eyes of others and sat in a more private location. Also, he should never have left the laptop unattended. Portable devices such as laptops and PDAs require extra vigilance because of the increased risk of theft. Let's take a look at how he could have better protected patient information.
Hello? Hey, Ted, what can I do for you? Yeah. Hold on, Ted. Can I call you back in about 5 minutes? Yeah. Thanks, okay? All right. Hey, Ted. Sorry about that. I'm in a private spot, so now I can send you that information. Yeah. Okay, thanks. Bye.
Double latte and a bagel?
By focusing on the essentials outlined in this video, you will help ensure that your organization remains in compliance with HIPAA's privacy and security rules. This means protecting the confidentiality and the security of patients' information by following your organization's policies and procedures. Doing so is the responsibility of every staff member in your healthcare organization.